Finding the cause of ailments is the most familiar application of medical laboratory tests, but that is only one of the central roles of laboratory tests. There are much more applications in the patient healthcare pathway. In this video, we will look at the other roles laboratory tests play in the healthcare journey. Laboratory medicine is central to providing experimental evidence and information that support the interactions between patients and their physicians or caregivers. The data generated from appropriately conducted laboratory tests significantly increases the capacities of physicians and caregivers to understand the patient health conditions and make the most appropriate decisions for their optimal care. There are 5 points in the patient healthcare pathway that laboratory tests play a significant part in their effectiveness. They are the screening or case finding point, the prognosis and risk stratification point, the diagnosis point, the treatment selection point, and the treatment monitoring point. Screening or case finding point. In the screening or case finding point, clinical laboratory tests are useful in finding out the early likelihood that healthy persons who show no signs have a disease condition or may develop certain types of diseases or disorders in the near future. While screening is done in target groups of populations such as age groups or gender groups, case finding looks for particular individuals who may be at risk. Screening tests provide information that help healthcare providers decide on what further assessments and care can be given to the identified individuals. Screening tests have been successfully used to identify people who are at risk of developing certain types of infectious and non-infectious diseases. The most common screening tests for infectious diseases are HIV and hepatitis tests, while the most common screening tests for non-infectious diseases like cancer are human papillomavirus screening for cervical cancer in women above 21 years, fecal occult blood screening for bowel cancer in people older than 50 years, and prostate-specific antigen screening for prostate cancer in men older than 50 years. Prenatal and newborn screening tests are also used to identify the likelihood of inheritable and non-inheritable diseases and disorders during pregnancy and immediately after the birth of the newborn. Prognosis. Prognosis is the prediction of whether a person with a disease condition will improve, worsen, or be stable over time. It is also a way to predict how the outcome of a particular treatment will be for a patient. Risk stratification, on the other hand, is a process of assessing whether a person or a population is at risk of suffering a particular disease condition due to risk factors like genetic, environmental, nutritional, or metabolic factors. Laboratory prognostic tests help clinicians to make these predictions. This allows for the patient and clinician to be on the lookout and for medical interventions to be made promptly. The most common application is in the management of cardiovascular diseases in diabetes. Because of these, laboratory tests are very useful in the formation of clinical guidelines for the management of many diseases and disorders. Diagnosis. This is the most familiar use of laboratory tests. Laboratory diagnostic tests are central to the process of finding out the causes of a wide range of medical conditions in patients with symptoms. It provides relevant information to identify unexplained causes of medical conditions and to definitively confirm provisional diagnoses made by physicians and caregivers. Laboratory diagnostic tests also help to identify early signs of developing diseases, the stage of diseases, or the degree of damage already done, so that interventions can be given promptly and appropriately. This use is central in emergency care, outpatient care, or inpatient care, as well as in making decisions for surgical procedures. Treatment selection. Laboratory tests are useful in identifying the suitability of particular types of treatment to particular individuals. It helps physicians to make decisions on doses of medication to be given, the likelihood of patients' response to a particular treatment, and to confirm conditions that certain treatments should not be given. Common application is in choosing antibiotic therapies for infectious diseases as well as therapies for other non-infectious diseases. Monitoring of treatment response. After the initial medical interventions, Laboratory tests are very essential to guiding the physicians and caregivers on the outcome of the interventions given in the forms of medications or lifestyle changes. It helps physicians to make decisions about the need for change of therapy, change of dosage of medication, or to certify that the patient is stable, cured, and due for discharge if hospitalized. As you have learned, laboratory tests are essential aspects of healthcare, not only for identifying causes of diseases, but for a number of other functions. Although laboratory processes are largely done out of the view of patients, the patients are welcome to understand these processes better. That is why Diagnoville is poised to improve patients' understanding of laboratory processes. This is in order to enhance patients' laboratory experience and the overall healthcare experience, especially in Nigeria and Africa. I hope you learned a lot in this video. If you're new to our channel, remember to subscribe to keep up to date with our educational videos. Like, share, or leave a comment or question.